Hey guys, welcome back to the Fertility Confidence Podcast. Happy Monday for me, but it's going to be Tuesday or any other day of the week, I guess. I probably shouldn't have mentioned that, but I am recording this on Monday, April 8th. We're supposed to be seeing this eclipse later this afternoon, but where I am, it's looking pretty cloudy. We've got a little bit of time here for the clouds to roll out, but I'm not holding out hope that we are actually going to be able to see anything. So I hope where you are, you got to see something cool and you were safe and your eyes are well and all that jazz. We're probably going to have to find some sort of stream on YouTube to show the kids what it actually is, because they keep asking questions and I keep telling them, like, I don't know if we're actually gonna be able to see anything, guys. And I'm glad I sort of set them up for failure, because sure enough, the clouds have rolled in and we're going to miss out on this really cool thing. So wherever you are, I hope you got to see something. I had a conversation with one of my team members this morning that actually sparked the recording of this episode, because she had a call with someone who is interested in working with us inside Fertility Confidence Method. And she came to me and said, she's 43 and her doctor won't refer her to a fertility clinic. And I was like, oh, that's weird. Well, how long have they been trying? And she said, I can't remember how long she said, but she said her doctor said that she had to wait 12 months. And the rage that I felt in my body was not great. And here's the reason. I actually just put a post out last week as well, why I typically recommend getting that fertility clinic referral sooner rather than later. And here's why. And I kind of want to expand on that a little bit. But first, what are the actual guidelines? So I want to acknowledge that it's incredibly easy for me to sit here in this chair and tell you guys, my community, tell my clients and my patients, like, go and get a fertility clinic referral and let's just get the ball rolling. And also, it's another thing to actually get one. Right? I know it's not that easy out there. And especially depending on where you live, it can be even more challenging. And that's actually one of my reasons for starting the process sooner rather than later. But what are the actual gold standard requirements? This should be something across the board that is followed by all family medicine practitioners and OBGYNs, because it's quite literally the practice requirements. And that is, if you are under the age of 35, and you've been trying for 12 months, that warrants a fertility clinic referral. One of the unfortunate loopholes I've seen with some practitioners is that if you've had miscarriages, they'll actually restart your 12 months. I don't think that's very fair, and I typically have clients push back on that. Then if you are over the age of 35, it's 6 months. If you've been trying for 6 months, you should be sent to the fertility clinic. Do I agree with those guidelines? No. I actually don't. I do think that we should be allowed to explore those options when we feel appropriate for our body. But I also understand that they're there as practice guidelines, and sometimes we have to follow them. But this client in particular was over that 35 age bracket, and her practitioner was following the under 35 age bracket. And we're doing that client a huge disservice by not approaching it from all angles. So the other sort of, sub bucket of that, I would say, is that if you have endometriosis, we also want you getting into the fertility clinic stream sooner rather than later, in case we need that support. And we know from the literature that women with endo should be exploring assisted reproductive technology sooner rather than later in order to have the best possible chances of getting pregnant. So there are caveats to the rules, but there are also rules to follow. And when they're actually not being followed, that's when I get very upset, because not only is, she's 8 years over that age cutoff and the time frame of trying. And the longer we wait, the more difficult it's going to be to do treatment. So why I like sooner rather than later, and again, understanding that it's not always that simple, but I always coach and remind my clients and my patients that just because you're walking through that door, that does not mean that you're closing the door to getting pregnant at home and you're now doing IVF or nothing else. And I think that's a lot of fear that we have around getting that referral or not feeling ready to do that, is that it feels very final. It feels very last, effort. And we don't have to approach it that way. But the fertility clinic is a great place to go and have some of that physical assessment done, getting the HSG, checking your tubes, having a sonohystogram, making sure there's nothing else that hasn't been picked up on like a standard ultrasound. And a lot of women aren't even getting an ultrasound from their family practitioner. So having all of that physical workup done. Another piece I find is a lot of couples aren't having their partners assessed when they're just, talking to their family care practitioner. And that's a big piece of the puzzle. If your partner hasn't had a semen analysis yet, often the fertility clinic is the route that will actually get that done, or at least get that done quicker. And then if we find something and we now need a urology referral, some clinics might actually have that in-house, which will speed that up, or at least get that referral sent off quicker than like not doing it all, essentially. So having that physical assessment piece done, having that partner assessment piece done, doing that at the fertility clinic just makes good sense, honestly. Does that mean you now have to walk into treatment? If you're mentally not ready for that, that's fine. And that's a whole nother conversation. One of the things that we really do with our clients inside Fertility Confidence Method is help them make informed clinical decisions. So if a client comes to us with this piddly little workup done and they're saying, I met with the doctor and they said that I really should do IVF, and that just doesn't make sense based on their case, we'll help them, and they're not ready for that, we'll help them advocate for other options. If that's what the doctor's recommending and it makes sense based on what we see in their case and their testing, and they've done all the things and they've had their workup done, we'll help them get to that place mentally where that feels like a good option for them. But at the end of the day, you get to make that decision, and you can't make that decision without having all the facts. And that's a big downside I see with a lot of clinical care, unfortunately, is we're getting these very basic workups done and then just being told like, well, you've been trying this long, so like IVF makes the most sense. And if you're not matching that energy, if you're not open to that, or if you're not willing to go down that road, that's okay. And so having other options of how we're going to help improve your chances to the best of our ability makes sense. And that's where working with a care team that's going to look at your body as a whole, because fertility is not just a uterus issue, it's a whole body, it's a whole couple issue, really, not just your body, but your partner's body as well, unless you're using a sperm donor. And then if we don't know them, then obviously we don't have ways to influence or impact that, but it's still a whole body issue. And so for those of you who are in that kind of time frame, let's say 6 to 12 months, and you're wanting more and you're wishing that you're getting more support, and maybe you've asked for a clinic referral and you've been turned down, or maybe you've been given a clinic referral, but you now have like a 5-month wait or a 4-month wait or what have you, know that there is so much we can do while you quote unquote wait. We don't have to just sit there and wait. There's a whole piece of your health that the clinic isn't even going to ask about or look at or quite frankly care about. And that's just not their zone of genius, and that's fine. They're really good at what they do. But when we're looking at how do I maximize my efforts here, how do I actually have the best chance of success, we need to be having conversations around nutrition, around your supplements, around lifestyle, around all three of those things for your partner, around your stress and your mental emotional health. And these are aspects that the clinic is just not going to be the best place to get good, helpful resources and information from. It is incredibly challenging to navigate all the different supplement options out there, especially if you're looking for something that's high quality and it's actually going to get the job done. And so I've partnered with my friends at Needed after specifically finding their powdered prenatal option was a really, really great way to reduce supplements and just overall pill count for my Fertility Confidence Method clients, but also for my clients who struggled with swallowing large pills. Needed offers premium supplements for every stage of the journey, from egg and sperm quality, support for preconception phase, to lactation and sleep support for postpartum. And the reality is that 95% of women in the perinatal stage have nutrient deficiencies. So while we simultaneously work on nutrition, we can also bump these levels up through safe and impactful supplementation. So you can learn more at thisisneeded.com and make sure you use the code Dr. Kelsey, DrKelsey, for 20% off your first order. So it's not one or the other, and it's also not sit around and wait. You have options. There are a ton of ways that you can get support. And if you are in that headspace of I need more, whether it's because you're waiting for a referral or you're not quite there yet, Fertility Confidence Method might be a good fit for you. You can absolutely come and check that out and see. But more than anything, I really want you to walk away from this conversation knowing that if you know or feel in your gut that you need more support and there's currently a roadblock to get you there, there are other avenues to take. And sometimes you just need help finding them. And there's nothing wrong with you advocating for better care of your health and earlier referrals. And one of the main reasons I really help people push for that, truthfully, is because you might wait 3 months to get into the fertility clinic. You might then wait another month before you can even do your testing, and then another month to actually do the testing, and then another month to actually meet with the doctor. We're now 6 months before you're even doing treatment. Whereas if you're mentally like, oh, I don't know if I want to do that. I don't know if I'm there yet. I don't feel confident that I've tried everything before taking that step and I need to feel that level of confidence, that's fine. But you can get the testing and all that done with the clinic and then say, okay, cool. I'll call you when I'm ready. Yes, some clinics are going to redo the testing if you wait more than 6 months. So there is a bit of a clock on it, but you at least now have your foot in the door, right? You have your foot in the door. There's now when 2 months go down and you're like, okay, I haven't gotten pregnant, but I'm feeling good. I've done the things. I've implemented the strategies. I've been working on my egg quality. We've dialed in our nutrition. Now I'm ready to explore this as some support. Now you can just pick up the phone and say, hey, it's day one and I want to do that thing that you told me to do. And you're just walking through the door. You're not actually waiting 6 months once you're finally ready. So having these conversations with your practitioner earlier than you feel is necessary is important. And this is something I would definitely share with your partner, because that's also another factor I find when we're talking with women who are ready for support. They're there, they're ready, but their partner's not there yet. They want to keep trying, and that's fine. You guys have to be on the same page. But having this conversation of like getting support and getting help, it doesn't make you any lesser of a person. But when it's around the fertility clinic, especially if that's what's making them feeling some type of way, we don't have to do anything just because we walked through the door. And for a lot of couples, it feels like once I walk through that door, I'm closing all the others. And that's just simply not true. So if you are over the age of 35 and you've been trying for more than 6 months and you haven't been referred to a fertility clinic, even if you mentally don't feel ready for that yet, I highly recommend just getting your foot in the door. Getting that extra testing that you possibly haven't had done, and then making a good informed clinical decision. And if you need help with labs and what that looks like, Fertility Labs 101 is a really great place to do that. We've pulled out all of our initial testing that we want to see, as well as the advanced maneuvers for both men and women and what the optimal levels look like. So that when you get your labs done and you're being told, everything is normal, we can actually take our labs, plug them into our sheets and say, well, is it normal or is it optimal? Because there's a difference. So if you need help navigating that, Fertility Labs 101, I highly recommend. $17, no brainer. I'll pop the link for you guys in the show notes so you can grab that. And like I said, you can be proactive while you're waiting, okay? If you're in that early time frame and you're ready for support, there's quite literally no such thing as too early. The earlier, the better. And we've had a couple of clients actually join us in the last few months who had been following me for years and then finally took the plunge, and we're working on things and we're doing things, and they're like, I wish I just joined you sooner. Because the support is so important and the personalization is so important. So I feel like this conversation took a bit of a side bend there. I really wanted to just help curb any fears that you might be having in terms of making those decisions. But I hope that this was helpful. And I also want to acknowledge that if you're sitting there going, but I've asked and no one's giving it to me, ask again. Ask someone else. Like, if you feel in your heart of hearts that you are ready for that step, don't take no for an answer. And at least here in Ontario, some clinics we can self-refer, do your research. There are options for you, but I'm also sending you lots of virtual love, knowing if you're fighting the fight and not getting anywhere, how incredibly, incredibly challenging that is. I see it, and I work with women all the time it's just an uphill friggin' battle to get proper care. And it continues, as much as it angers me, it also continues to fuel me to do what I'm doing, because there's so many people out there still that are trying to get pregnant that don't understand there's more to it than this sequential system of ask my GP for help, get shut down, ask my GP for help, get shut down, ask again, get sent to an OB, do a tiny bit of testing. They are like, keep trying. Okay, now more time's gone by. Okay, cool. You're still not pregnant. I guess now we'll send you to the fertility clinic. Now you have to sit and wait for that. Like, the system is broken. But the good news is that there's so many other ways to support your body that, regardless if you need the fertility clinic or not, are incredibly important and also strongly evidence-based and research-based to help improve your chances of conceiving. So I'll drop the link for Fertility Labs 101 in the show notes. I'll drop the link to book a call with my team to see if FCM is a good fit for you into the show notes, and I will chat with you guys next week. Take care.